Hey guys, Blake here once again to present the latest video in our video series. Since we just discussed survey statistics, it's time to start discussing the survey errors that can accompany these statistics. There are two main types of errors that we'll be discussing in this video. A type 1 error, which is a false positive error, and a type 2 error, which is a false negative error. Let's get into detail for each of these types of errors. A type 1 error is more colloquially known as a false positive conclusion. For example, a COVID test says that you have COVID when you actually don't. In this case, you incorrectly rejected the null hypothesis, which states that you do not have COVID. Now, in type 1 errors, because we incorrectly rejected the null hypothesis, our results were statistically significant. However, in reality, these results came about by chance or because of other unrelated factors. The risk of committing a type 1 error is based on the significance level alpha that you choose. Alpha is a value that you set at the beginning of your study to determine the statistical probability of obtaining your results. The significance level is usually set at 0.05 or 5%. This means that your results only have a 5% chance of occurring or less if the null hypothesis is actually true. Now, if the p-value of your test is lower than or equal to the significance level, it means that your results are statistically significant and consistent with the alternative hypothesis. If your p-value is greater than the significance level, then your results are considered statistically non-significant and you would fail to reject the null hypothesis. To reduce the probability of committing a type 1 error, you can simply set a lower significance level. In other words, we will only consider the results statistically significant if the p-value is very small. A type 2 error is indicated by a false negative conclusion. For example, a COVID test says that you don't have COVID when you actually do. In this case, you incorrectly failed to reject the null hypothesis, which states that you don't have COVID, when in fact, you should have rejected it because your null hypothesis was false. In a broader sense, a type 2 error means failing to conclude that there was an effect when there actually was. In reality, your study may not have had enough statistical power to detect an effect of a certain size. Statistical power is defined as the ability to detect a real effect from your sample when there truly is one. The risk of committing a type 2 error is inversely related to the statistical power of the study. This means that the higher the statistical power, the lower the probability of making a type 2 error. Statistical power is determined by the effect size, meaning that larger effects are more easily detected, measurement error, meaning that systematic and random errors in recorded data reduce power, sample size, meaning that larger samples reduce sampling error and increase power, and significance level alpha, meaning that increasing the significance level increases power because the threshold which allows us to reject the null hypothesis is now lower and easier to reject. In order to indirectly reduce the risk of a type 2 error, you can increase the sample size or the significance level. However, be careful when increasing the significance level alpha because increasing alpha also increases the risk of a type 1 error, which we've discussed previously. It's also important to know the formula for statistical power, which is 1 minus beta, where beta represents the probability of a type 2 error. Alright everyone, that wraps up the content that you need to know relating to survey errors, so let's finish off with some example questions. Question 1 asks, if a patient has a disease and tests negative for it, which does this describe? We have option A, true positive, B, true negative, C, false positive, and D, false negative. And the correct answer for this question is option D, false negative. So the false is referring to the fact that the test reported a wrong diagnosis. The negative is referring to the diagnosis that the test provided. False negative is when a test incorrectly says a patient is negative for a disease when they actually have the disease. Next up, we have question 2. A dentist observes a lesion in a patient's mouth and diagnoses it as cancerous based on visual inspection alone, but a biopsy reveals that the lesion is unrelated to cancer. Each of the following is true of this scenario except one. Which one is the exception? We have option A, the dentist gave a false positive diagnosis. B, this is an example of a type 1 error. C, the biopsy contradicts the initial diagnosis. And D, this is an example of a type 2 error. And the correct answer for this question is option D, this is an example of a type 2 error. So when the dentist diagnoses the lesion as cancerous, he is saying that the result is positive. However, since the biopsy revealed it's unrelated to cancer and contradicts the dentist's initial diagnosis, it is false. This makes this scenario a false positive scenario. Recall that false positive errors are type 1 errors. As we can see, this makes options A, B, and C all true. Meanwhile, option D states that this is an example of a type 2 error. Since this statement is false, we know that answer choice D is the correct answer for this question. And last, we have question 3, which asks, which of the following is the correct formula for calculating the statistical power of a study? We have option A, 1 minus the probability of a type 1 error, option B, 1 minus the probability of a type 2 error, Option C, 1/2 times the probability of a type 1 error, and option D, 1/2 times the probability of a type 2 error. And the correct answer for this question is option B, 1 minus the probability of a type 2 error. So recall that the formula for calculating the statistical power of a study is 1 minus beta, where beta is the probability of a type 2 error. This makes answer choice B the correct answer for this question. So to summarize, in today's short video, we discussed type 1 versus type 2 errors and applied these concepts to real life scenarios in some example questions. Keep on plugging away, and I'll talk to you all in the next video.